I've been working in air pollution for the past 20 years, and some of the work that I probably appreciated the most is the more recent work where I've been developing add-ons to software tools that WHO has been developing and extending its capabilities. One such add-on is the Disability Adjusted Life Year calculator, which allows the user of the tool to calculate the combined ensemble of losses in life expectancy as well as years that you lived in disability. And the combined index is this disability adjusted life year. The way the procedure goes is you start with looking at the population that you have that you're studying, and you look at the risk particularly imposed on this population due to air pollution, outside air pollution, and then you apply this risk as the population ages. And so a life table is essentially a process in which you follow a population from the current state until the population is exhausted. And so you apply these risk factors which relate the exposure that the population is exposed to a risk on health. Specifically, let's say in the case of years of life lost, you look at the reduction in lifetime expectancy. Then you add up the years that a population lives for a particular age, and you compare it against a population that is exposed to a different level of pollution or perhaps is exposed to no pollution. And then you compare the two populations and you calculate what is the loss of life as a result of being exposed to this air pollution. And the second part of the equation then is calculated through coefficients that relate years of life lost to disability years, and then the two numbers are aggregated together. And that's one study that I'm very proud of. The other one is the update of the risk functions, these associations for the global exposure model, GEM, which was recently published in the Proceedings of the National Academy of Science of the United States, together with Professor Richard Burnett and the usual big names, big people that have been involved in this work. And these functions have been derived using different approaches, and more importantly, they now take into consideration a wider range of diseases. Prior work by the Global Burden of Disease has looked at 5 different causes of death that cover the cardiovascular and the respiratory diseases. The GEM model looks at the non-communicable diseases. And that means we take into account things like diabetes, and we take into account things like cognitive ability. So these functions provide results that are about a factor of 2 or so higher than previous estimates. But more importantly, they do not curve at higher concentrations, which means countries like China and India that want to invest in technology to reduce and to improve air quality, they now have a benefit that is larger, that can be quantified, and that can offset the cost, making the transaction cost effective, which perhaps before was only marginally. So these functions take, as I said, they take into account the entire set of non-communicable diseases. And just to give you an idea, the most recent publication of GBD in 2016 estimated approximately 4 million deaths attributable to outdoor air pollution. WHO in 2018 also carried out a similar calculation and obtained a similar number. Under the GEM, the mortality is increased to about 9 million. And to put this into context, 4 million and 9 million deaths represents 1 to 2 deaths out of 10 deaths worldwide. So it's a significant burden that air pollution imposes on our everyday existence.